Jahalonen. When my mother got ill, I didn't realize she was sick even though I had been a general nurse for 15 years. For several months, she had been complaining of no appetite, fatigue, insomnia, and itchy skin, and looking back I remember how deflated she was. But I didn't notice any of that, nor that she had lost weight. One morning, I called in to see her. She was disoriented, calling me Jenny instead of Merja, and her blood pressure was much too high, so I drove her to hospital. On the way, she started having seizures, and later that day she died. Diagnosis: renal failure. I had never thought about renal failure at the time. I thought she was just showing symptoms of aging, and I feel very guilty about that. After the funeral, I went to the hospital library and laid off on nephrology. Later, I applied for specialist training and became a renal nurse. My mother did taught me how important it is for everyone involved in illness to talk and listen. It's true for all types of nursing, but with renal nursing, most of the patients I get to know are chronically ill, so I see them over long periods of time, and we have the opportunity to do a lot talking. Some renal dialysis patients, for example, come to the clinic 3 times a week, every week. I'm their first port of call for help with both practical and emotional problems, and I'm their main source of information on medication, equipment, and diet. I frequently cancel kidney transplants, donor, and recipients, but because I know from personal experience how illnesses like kidney failure affect everybody connected to the patient, I also make sure I hear about that worries and concerns of care partners and family too.